In this session, Dr. Miller and I will report on the safety profiles of approved and emerging anti-LAG-3 PD-1 combinations and provide guidance to optimize their use in treatment of advanced melanoma. As we have understood, safety is an important consideration for patients with advanced melanoma on dual immunotherapy regimens. Previous combinations have come with increased efficacy, but significant grade 3 toxicity, including colitis, pneumonitis, and others. When you try and move these combinations into a general population, the risk of these toxicities for long-term morbidity and mortality becomes significant, and therefore a combination regimen with lower toxicity is important here. As you can see, the safety of dual inhibition of LAG-3 and PD-1 in the Relativity 47 study with nivolumab and relatlimab, the grade 3 and 4 adverse events reported were significantly lower than the combination of ipilimumab and nivolumab seen in previous studies. Only 9% led to treatment discontinuation. In Checkmate 67 with ipilimumab and nivolumab, treatment-related adverse events of grade 3 or 4 nature were 55%. In Relativity 47, that rate was only 21.1%. The focus here is not only on increased efficacy for patients, but also decreased morbidity or toxicity. We've seen similar in the combination of fianlimab plus cemiplimab, where overall the grade 3 or 4 toxicity rate was low, 11.3% with fianlimab plus cemiplimab. Dr. Miller, what are your thoughts on this combination, its toxicities, and the future of these combinatorials in clinical care?
I don't think any of us were surprised that an increase in efficacy was associated with an increase of immune-related adverse events compared to monotherapy. But I do think this added safety signal is overall fairly reasonable given the encouraging efficacy signal that we see with combination therapy.
I agree with you. In the next session, we'll discuss how Dr. Miller and I personalize treatment selection for patients with advanced melanoma.